start our lecture about diseases of kidney. We will discuss in this lecture the congenital diseases of the kidney, classification of and causes of cystic diseases of kidney, tumors of kidney, renal stones, and tumors of urinary bladder. First, let's discuss the congenital anomalies of kidney. We have agenesis of kidney, which is a complete and bilateral abscess of kidneys in both sides. This is incompatible with life and is encountered as a stillborn، يعني يجي للدنيا ميت أو early death, short period after birth. Neonates will die. طبعا generally this type of anomalies is associated with other types of defects، مثلا يعني of congenital anomalies، مثلا hypoplastic lung أو limb defect. Renal hypoplasia refer to failure of kidneys to develop to normal size. There is kidney, but there is loss of renal tissue, so the kidney will be small and atrophied. This is called renal hypoplasia. Horseshoe kidney, there will be fusion of two kidneys either from the upper pole or from the lower pole. مشكلة الهورسشو kidney إنه it associated with urinary obstruction and renal infection, pyelonephritis. The incidence of horseshoe kidney, it occurs in about 1 in 500, 1 in 500 to 1 in 1000 autopsies. Cystic diseases of the kidney. Here we have the three categories of cystic disease. These are either hereditary, which is associated with genetic defects, developmental but non-hereditary, which develop during intrauterine life during embryogenesis. There is defect in formation of kidney and there will be cystic structures formation, but not genetic. There is no gene defect. And we have acquired disorders. As a group, why it is important to study cystic disease of the kidney? This is because they are common. Although they are common, they might be discovered incidentally during abdominal ultrasound for any other cause for any clinical symptoms. So they are common. They can cause chronic renal failure and important clinical problems. They occasionally be confused with malignant tumors. Radiologically, commonly the radiologist describe that there is a mass and might be confused with malignant tumor. Classification of cystic diseases of kidney. We have cystic renal dysplasia, polycystic kidney disease, which is divided into adult type, autosomal dominant polycystic kidney disease, and childhood type اللي هو autosomal recessive polycystic kidney disease. Medullary cystic disease, which include medullary sponge kidney. medullary sponge kidney هي يعني فد congenital disorder of kidney that is characterized by cystic dilation in the collecting tubules. هنا collecting tubules راح يصير بيها dilation. طبعا مشكلة الميدلري سبونج كدني إنه هي associated with recurrent UTI and then stone formation. Nephrolithiasis, again here there will be inflammation associated with fibrosis and scarring of renal tissue, and this will be associated clinically with impaired renal function, so it will lead to renal failure. Patient presented with polyuria. Acquired dialysis associated cystic disease, localized simple renal cyst. هذا واحد من ال types of renal cyst that can be discovered incidentally during ultrasound. renal cyst in hereditary malformation syndrome مثلا tuberous sclerosis. tuberous sclerosis هو autosomal dominant multisystem disease that's associated with defects in multiple organs in the body, including brain, liver, heart, lungs, eyes, skin, in addition to kidney defects. الديفكت بالكدني ممكن يكون renal cyst أو ممكن يكون benign tumor اللي هو angiomyolipoma. glomerulocystic disease. renal dysplasia احنا قلنا هو developmental but not hereditary. It occurs due to defects during embryogenesis and intrauterine life without a specific gene involvement. This is هنا there will be undifferentiated tubules surrounded by primitive mesenchymes and some heterotopic tissues such as cartilage. Cysts form from abnormal tubules. Pathologically أهم شيء بهذه طبعا هذه grossly هذه renal dysplasia grossly we can see multiple cysts of different size formation, وهذه الcyst هي من defect in tubular epithelial structures يعني differentiation. هذه هي renal parenchyma راح تكون focally موجودة. بالنسبة للمايكروسكوبيك findings of renal dysplasia اللي راح يصير هو هذه dilated tubular الtubules هيك تصير cystically dilated lined by columnar أو cuboidal epithelium, and we have a primitive stroma, loose stroma, which is only primitive, not well developed, and here we have focus of cartilage. الautosomal dominant polycystic kidney disease هنا نحن polycystic kidney disease we divide it into two types, adult type which is autosomal dominant and the childhood type which is autosomal recessive. طبعا الautosomal dominant هو more common than childhood type autosomal recessive. هنا عندنا numerous cysts will be formed in the renal parenchyma مثل ما نشوف هنا الكدني is increased in size, and here we have multiple cystic structures filled with a clear to brown fluid. طبعا السايز يكون different and it might reach a large size, it might reach 4 cm. polycystic kidney disease can patients can present with يعني renal failure ممكن clinically most هو end stage renal failure. طبعا ممكن يجي hematuria, abdominal pain, ممكن urolithiasis, ممكن repeated يعني urinary tract infection, ممكن يكون عنده hypertension. All these features can associate with autosomal dominant polycystic kidney disease. أهم شي هنا عندنا الجين هو احنا it is genetic disease, so it is autosomal dominant. الجين اللي involved هنا عندنا two genes هي PKD1 gene و PKD2 gene. ال PKD1 هو more commonly involved. PKD1 mutation occur in تقريبا 85% of cases, و only 15% of cases there will be mutation of PKD2 gene. طبعا ال PKD1 موجود على كروموسوم 16 وال PKD2 موجود على كروموسوم 4. هنا طبعا الانسيدنس مال autosomal dominant polycystic kidney disease تقريبا يصير 1 to 2 per 1000 birth incidence. Sex relation, there is no sex relations occurs equally in both male and females. هنا الجين انكود او انكود بروتين اسمه بوليسيستين 1 polycystin 2 polycystin PKD1 associated with polycystin 1 mutation PKD2 mutation associated with polycystin 2 mutation. طبعا هذا الجين هو important in cell differentiation and cell proliferation and cell polarization and membrane transport and هو actually exact mechanism of cyst formation is unknown لكن اكو theories انه هذا الجين هو important in cell proliferation, cell differentiation and in polarization of cells. However, the cyst is formed in all regions of the nephron and then enlarge, expanding in size, يبدي small بعدين increasing in size with increased age. بالبداية normal renal function is maintained and then there will be a deterioration of renal function in adulthood period. Most patients يصير عندهم هذه الفيتشرز. Autosomal recessive polycystic kidney disease, this occurs in infants and طبعا it's characterized by cystic formation in the collecting ducts. It is rare compared to adult polycystic kidney disease and 25% of infants die in the neonatal period and this is because of associated other congenital anomalies مثلا pulmonary hypoplasia أو يصير عندهم oligohydramnia يعني decrease the amniotic fluid that is seen by ultrasound during pregnancy. So all patients with oligohydramnias ممكن يكون أكو suspicion of polycystic kidney disease عدل يعني الفيتس طبعا. هنا important point على ال polycystic kidney disease احنا قلنا هو ممكن يكون autosomal dominant وممكن يكون autosomal recessive. إذن family history is important. However, 10% of patients with PKD does not give a family history. 10% يكون no family history and they are considered as a new mutation. They develop a new mutation because there is no family history and this occurs in 10% of patients with polycystic kidney disease. Now renal stones, nephrolithiasis and urolithiasis. What is the definition of nephrolithiasis? Nephrolithiasis هو presence of stones in renal collecting system while urolithiasis in the urinary tract. Stone formed in the renal pelvis and calyces. It varies in composition according to individual factors, geography, metabolic alterations, presence of infection. We have four major types of renal stones. We have calcium stone, infection stone, uric acid stone, and cystine stone. Calcium stone هو most common type and it accounts for about 75% of all types of renal stone and it's made up of calcium and oxalate or calcium and phosphate. Infection stone, this occur in because of infection with urea-splitting bacteria like Proteus. هنا characteristic feature of staghorn of infection stone هو formation of staghorn stone. هذه staghorn stone, this is kidney. هنا عندنا dilated renal pelvis and calyces, and this is the staghorn stone which is present in the renal pelvis, and it takes the shape of the renal pelvis. عندها branches، عندها تفرعات، ولذلك يسموها staghorn stone مثل قرن الغزال. uric acid stone it occur in 25%. أنا من أسمع uric acid stones أتذكر إنه هذه التايبس of stone هي ممكن تكون إذا كانت pure uric acid، الكومبوننت مالتها pure uric acid, so it is radiolucent not discovered by radiology، ما تبين، تكون radiolucent. Cystine stone هذه very rare and it accounts for only 1% of all types of stones, and this is important in childhood types of stones, and it occurs because of hereditary cystinuria. Now tumors of the kidney، احنا نعرف كل organ ممكن يصير ب benign tumors وممكن malignant tumors. هنا ال benign tumors of the kidney هي عليها question mark إنه whether to regard these benign tumors as malignant، لأنه شافوا قسم من ال benign tumors شلون عرفوها benign microscopically ما بها features of malignancy، لكن هي عندها tendency for metastasis. فدائما يخلون السايز اوف 3 cm هو يعني cut off point اللي اقل من 3 cm هذا distant metastasis بي يكون قليل، لكن اللي اكثر من 3 cm حتى اذا كان microscopically يعني ما بي features of malignancy هذا ممكن يكون يصير metastasis distant metastasis. هنا ال benign tumors of kidney, first we will discuss the papillary renal adenoma, and as we mentioned هنا أكو controversy whether to regard it as benign, and they push the size of 3 cm as differential points. هنا الميكروسكوبيكلي قد يكون clear cells، قد يكون chromophore، أو قد يكون collecting duct cells، وهذه كلها بيها malignant counterparts. يعني أكو عندنا clear cell adenoma، أكو clear cell carcinoma، chromophore cells benign malignant نفس الشيء collecting duct. الرينال أونكوسايتوما، كلمة أونكوسايتوما جاية من acidophilic cytoplasm. So this tumor shows acidophilic cytoplasm because of excessive mitochondria deposition, and so there will be abundant finally granular acidophilic cytoplasm. grossly دائما يكون well circumscribed, and كincidence it accounts for 5 to 10% of primary renal neoplasms. Surgical removal is adequate and curable for the patient. And because it is benign, so it is important to differentiate between renal oncocytoma and chromophobe carcinoma, which is type of renal cell carcinoma, because treatment is differ and prognosis is differ. Here we have renal oncocytoma. طبعا هنا عندنا prominent acidophilic cells with tendency for tubular structures formation. Here we have round nucleus with little pleomorphism and lack nuclear features of malignancy. The cytoplasm is predominantly acidophilic, granular cytoplasm. So this is renal oncocytoma. Medullary fibroma. Medullary fibroma هي الأوريجين مالتها من الانترستيشيال cells of the renal parenchyma. Generally it is small and median size هو 0.5 cm in diameter. They are pale, well circumscribed because they are benign tumors, and usually in the mid portion of medullary pyramids. They are composed of small stellates, spindle cells, because they are fibroma. Fibrous tissue tends to be spindle, or maybe polygonal cells موجودة in loose stroma، يعني تطلع لونها فاتح pale microscopically. Angiomyolipoma, these tumors are strongly associated with tuberous sclerosis. احنا قلنا tuberous sclerosis هو autosomal dominant multisystem disease، يصير عنده multiple lesions and benign tumors in multiple organs in the body. الرينال involvement يصير على شكل ممكن يعني cystic disease of the kidney، ممكن يكون tumors. من هذه التيومر هو البناين تيومر angiomyolipoma. من اسمها angio يعني blood vessels، هذه vascular proliferation، this is blood vessels. myo معناها هذه المصل smooth muscle spindle cells proliferation، هنا عندنا هذه smooth muscle spindle cells proliferation، هذه myo. lipoma معناها adipose tissue. Here we have adipose tissue signature like. So we have angiomyolipoma, benign tumor of the kidney, has a strong association with tuberous sclerosis. يعني patients اللي عندهم tuberous sclerosis 80% من عندهم يصير عندهم angiomyolipoma. لكن إذا أخذنا كangiomyolipoma نصهم يصير نلقى عندهم tuberous sclerosis. Mesoblastic nephroma, this is congenital benign tumor of kidney, and it is a hamartomatous lesion. يعني شنو hamartoma؟ hamartoma يعني ألقى normal tissue أو benign tissue in abnormal site. يعني هذا التايب of tissue مفروض ما ألقاه بهذا المكان، لكن هو يعني هو benign، لكن normal tissue in abnormal site. Okay. هذا found in the first 3 months of life.